The topic that I have chosen to do for the roundtable discussion is mental health in elementary school students. Mental health is defined as a disease that has a psychological and emotional impact on someone. Mental health illnesses have been increasing over the past few years. This has become a concern for not only families, but teachers as well. Students spend about 7 hours in the classroom 5 days a week with their teachers. Their teachers get to know them on a personal level and tend to notice significant changes in students' behaviors and attitudes. Some teachers jump to the conclusion that because a child isn't completing their work or is distracting others means that they are being lazy or goofing off. The question teachers should be asking is this child okay? Maybe there's a reason that this student keeps behaving this way. There are many different factors that can attribute to someone who has a mental health illness. Some of these factors could be genetics, personal experiences, trauma, their environment, or a mix of these. Teachers should try to take notes on students who exhibit any serious changes in behavior. This is important because if a child does receive help from a professional, the teacher will have notes on the student's behavior that may help their diagnosis. In the United States, mental illnesses are deemed to be the chronic sickness in young people. About 1/5 of all children in school possess symptoms that would meet the criteria for a mental health diagnosis. Resources are scarce to address these issues, and students often do not undergo the appropriate evaluations to receive the help that they need. As future teachers, we want our students to be able to learn and grow in a safe environment, but children who have a mental health illness may struggle to do so. If we as teachers are educated on mental health illnesses, then we can help these students who may struggle succeed in the classroom. There are many different kinds of mental health illnesses. A few of these include clinical depression, anxiety disorder, ADD or attention deficit disorder, ADHD or attention deficit hyperactivity disorder, bipolar disorder, and PTSD or post-traumatic stress disorder. In a study completed in 2016, Suicide in Elementary School-Aged Children and Early Adolescents, they found that children who committed suicide were mostly African American males. They committed suicide by either hanging, strangulation, or suffocation, and they did this in their own homes. The study included 87 children and 606 early adolescents. Out of the 693 subjects, 210 of them had a mental health illness. ADD and ADHD were the prevailing mental health illnesses found in children who committed suicide. The researchers retrieved their information from the National Violent Death Reporting System. While this study only focuses on one gender and one race, we as teachers need to take a second to think about this. Mental illness in children is not as rare as we may think it is. If we as teachers suspect that a student is showing possible signs of a mental health illness, we need to address it by telling a school counselor or the school psychologist. Teachers should take the information from the study into consideration and think about what they can do to better assist their students who may have a mental health illness. In a study completed in 2014 by Powers and his colleagues, increasing awareness of child mental health issues among elementary school staff, they suggested that if we educate teachers and school staff on mental health, then it is possible that it will be easier for them to identify it in their students. If it can be identified, teachers and staff can take the next steps in assisting these students. While this sounds like a great idea, there are a few realistic aspects that need to be considered. A major one is the cost of this type of training. There would need to be room in the school budget in order to have a professional trained teachers and staff. Another factor that needs to be considered is time. Teachers and staff are already busy with their jobs, so finding a time to complete this training may be a challenge. Their study included a training session on the common mental health issues seen in children, such as ADHD, ADD, and anxiety disorder. Participants included classroom teachers, counselors, a principal, and an art teacher, just to name a few. Participants took a pre-test before the training on mental health, as well as an identical post-test after completing the training on mental health. After their training session, which included information on mental health, the participants were to answer a set of questions that covered the topics discussed in the training. The results show that the mental health training improved knowledge of mental health for the school staff. The outcome of this study illustrates that proper training in mental health informs teachers and staff on these illnesses. This means that teachers and staff will be more aware of mental health illness in the school. If they witness behaviors that correlate with a mental health illness, they will be able to act on it. This study, completed in 2011, focused on reducing the mental health disparities in children who have serious mental health needs but haven't gotten the correct care. The researchers wanted to implement what signs that parents and teachers should look for in their kids so that they are able to identify what mental health resources are needed. Unfortunately, it is not that uncommon that teachers and parents miss the signs displayed by a child who has a mental health illness. According to the United States Surgeon General, a majority of children who have a mental health illness fail to receive the necessary services even though they have the symptoms consistent with established mental health diagnoses, such as ADD and ADHD. This study is summed up by stating how essential it is that teachers are knowledgeable on mental health illnesses. New treatment options are accessible for children with mental health illnesses, but they are useless unless parents and teachers are properly educated on mental health and know when these services are needed. Teachers can assist students who have a mental illness in a variety of different ways. Teachers should take into consideration that a child with a mental health illness may experience difficulty paying attention in class as well as completing schoolwork. A possible solution may be coming up with a plan that works for both the student and the teacher. An example of this could be for a student who has ADHD, allowing that student to take a walk every 20 minutes around the classroom, or having them use a yoga ball to sit on instead of using a regular chair. These are just a couple of ideas that may assist the student in being successful in the classroom. Teachers can also educate themselves on mental health illnesses that are common among children. Being able to identify the possible signs mental health illnesses exhibited by students means that the teachers can seek out help. Teachers can go to the school counselor or school psychologist to address these behaviors and see what the next step would be for that student. Teachers should utilize the resources in the school. If teachers have concerns about a student or students, asking these professionals listed above is a step in the right direction. These professionals may also offer information on how to best educate a child or children with a mental health disorder. Lastly, teachers can be a resource for students. It's not uncommon for students to disclose personal information or traumatic experiences to their teachers. It is our responsibility as future teachers to listen to our students and ask them what we can do to assist them.